So now we're on to the next section in the book, and the first of these is going to be around doses in children. And what we're going to look at is how children respond differently to medications, and there's some of the considerations we have to take because of that. It's very common for mistakes to happen in giving children medications, and I think you'll see in the next few slides why that can be in a busy hospital. So very common for there to be errors, and we think that there are something around 20% of drugs given wrongly, erroneous administrations, that lead to significant sources of problem. So some of the most common types are dosing errors and incorrect rate of intravenous administration. So it's very easy for to get the dose wrong by times 10 or times 100, times 1,000 even, of overdose because of the decimal point. And if you were looking at units much earlier, you'll remember how easy it is to get that decimal point in the wrong place. And that can very quickly, in medicine, that can be fatal. And this is a piece of research which was done to highlight some of these administration errors. It's always good to go back to where the information comes from. Particularly, don't necessarily trust your lecturers. Go and look at the source information and see if you interpret the information in the same way. So what do we want to do with this? You should be able to understand after this section. So calculations involving dosing with children. And then we'll go on in the next 2 or 3 presentations to talk about things like density, displacement volume, and displacement values. Probably the things that people get wrong most in calculations exams are those densities and displacement volumes, so they are pretty important. And then we'll also talk about how molecular weights affect some of the calculations that we need to make. So the first thing to be aware of, as I alluded to earlier, is that children are different from adults. They certainly respond differently to medications, and medications have a different effect on them from adults. And the first thing we need to get right is the terminology. What do we call various stages of childhood? And the BNF has a chart for this, and it will be good for you to have a look and just be sure about what these are. And if you're thinking of exams, this is a really nice question that we could easily ask. So the first month of a baby's life, they're called a neonate. You'll be familiar probably with the idea of antenatal classes. That's before birth. Ante being before. Up to 1 year, after the first month, up to a year, they're called an infant. And then there are 2 distinct ages for development, and that's between 1 and 6 and between 6 and 12 years. In terms of medication, 12 years is seen as the boundary between child and adult. By the time a child gets to 12, they are their bodies are dealing with drugs in a very similar way to an adult. As I said before, important to remember these so that you are, if you're asked a question, you know exactly what these terms mean, particularly neonate and infant. Okay, so we're going to have a look at the idea of doses based on body weight and actually to some extent body shape. So first things First, as I already said, unless the age is specified, a child in the BNF includes those who are 12 years and under. And doses of a drug may be given as an amount related to the body weight or body surface area. The body weight would be in kilograms, the body surface area would be in meters squared. There's a number of complex reasons for that which we won't go into. I want you just to trust at the moment this is how it is for now. You will understand that later on in the course. And the idea is that although you might do that, if you've got a very large child, the dose that's calculated from the body weight may be greater than the maximum adult dose, and it would be very unusual to exceed that. So the general rule is not to exceed the adult maximum dose, whatever the weight or size of the child. So for example here, if we have a dose of 8 milligrams per kilogram and a maximum adult dose of 300 milligrams, if you had a 10 kilogram child, that would be fine because they would be given 80 milligrams, 8 times the 10 kilograms. But if you had a child weighing 40 kilograms, then the working out would say that you had 40 times 8, which would be 320 milligrams. But you shouldn't exceed the actual adult dose of 300 milligrams. I hope that makes sense. If not, have a read through a couple of times and just be sure that you're comfortable with that idea. However, what may happen is that you might actually calculate a dose which doesn't actually correspond to the dosage forms available. So there might not be a tablet or capsule of the size that you want it to have. So we may need to think about using a different dosage form. So what about these average body weights, etc.? Because we might be given the weight, but actually, if you think in practice, sometimes if a child's brought in, perhaps in an emergency, it may not be possible to weigh them quickly. So there is, in the BNF, there are some average values that are given in a chart. If you look in the BNF, and you will find the charts on average weights and heights for age. And you can see here that we have the chart. So for example, if we look at, say, a 6-month-old infant, then their ideal body weight would be 7.6, okay, and height 67 centimeters. I've already said that there's considerable variation, and that is true. And what will tend to happen if you have a pediatrician, they'll be pretty experienced at knowing whether it's a large child for 6 months or a small child for 6 months, and they will probably adjust those figures for giving drugs. But in general terms, these figures are broadly true for the age and size of child. Okay, so let's look at a question that might be given along these lines. So the first thing we need to know, and we'd find this out from the BNF, is that the recommended dose of fluconazole for mucosal candidiasis, and I'll let you look that up and find out what it is 3 milligrams per kilogram daily. So a daily dose for every kilogram that child weighs. So for every kilogram, they are given 3 milligrams. And what we have is a child aged 3 years old, and they want us to work out what the dose is and to suggest a suitable formulation. Okay, so the first step is to just see where we are in this question. So the dose is given as the number of milligrams of drug per kilogram weight of the child. In this case, we know that the BNF tells us we need 3 milligrams for every kilogram weight of the child. In a lot of questions, you will actually be given the weight of the child, so it's a straightforward conversion of however many kilograms. But this time you haven't. And just to illustrate the point that, as I say, in emergency, sometimes you won't automatically know how heavy the child is. So we can't, at the moment, work out how many milligrams to give of this drug because we don't know how many kilograms we have. So how can we work that out? Let's look at the average values chart in the BNF. We know that they are 3 years old. So if we look at the chart, we can see at 3 years old, the ideal body weight would be 14 kilograms. So from the table, we know that it's 14 kilograms would be the weight of the child. We're going to go back now, in working this out, we're going to go back to the idea of proportional sets. Hopefully remember what they're about. And what we want to do is say, well, if we know that it's 3 milligrams per kilogram, if they're 14 kilograms, how many milligrams of drug do we need to give? So here we've got the, to start off with, we've got the dose of fluconazole, which is 3 milligrams for every 1 kilogram. We know that our child has 14 kilograms, weighs 14 kilograms. What we don't know is how much that corresponds to in terms of the amount of drug, and that is Y there. So that's what we're looking for. And remember, we were talking about being able to manipulate equations. And so from this equation, we have one unknown, which is Y, and we can work out, and if you do the maths on that, you can see that it comes out as 42 milligrams. So the daily dose for a 3-year-old child is 42 milligrams. Question finished, you think. But actually, what you need to be aware of is that you have fluconazole as a drug comes in capsule form and in suspension. Now capsules are fairly fixed in the amount you can give, and the amounts they come in are 50, 150 and 200 milligram. So actually we can't get 42 milligrams from any of those. Can we get that from suspension? Well, we're told that we can have 50 milligrams per, let's get rid of these, so that we have suspensions which have 50 milligrams per 5 mil and 200 milligrams per 5 mil. Okay, so what can we do about that? Well, another consideration, of course, is that in some cases, even if there were a dosage available a dose form available that had the right dose, some people can't swallow, not only children, some people can't swallow capsules anyway. So in this case, what we know is that if in 50 milligrams in 5 mils is the concentration that we have, remember going back to strengths and concentrations, then we ought to be able to say, well, let's change the actual amount we give. So instead of giving 5 mils, we give however much of that suspension gives us 42 milligrams, because remember we want 42 milligrams is the dose that we want to give. So we now have an idea of what we might do next. So again, we come back to setting up proportional sets. And we know that, okay, yeah, what do we know? We know that we have a suspension which gives us 50 milligrams in every 5 ml. But we want 42 milligrams. So we need to know how many mils will give us 42 milligrams. How many mils of our suspension will give us 42 milligrams? Again, we go back to use it in manipulating that equation, and the answer we come out to is 4.2 mils of our fluconazole suspension should be given to the child each day. Now this is a fairly straightforward calculation, but it actually illustrates quite a lot of points. So really important that you get familiar with this and confident that you could work out how to do that yourself. Let's do something that actually the principle is almost the same. We just need to be aware that it uses slightly different figures, and it's important again that you read the dose instructions carefully and make sure that you're aware that certain drugs are given per body surface area rather than weight. So the question is to calculate the oral dose of methotrexate, which is suitable for a 5-year-old child who weighs 18 kilograms. And the oral dose is 15 milligrams per meter squared weekly. Okay, so that's our known, is 15 milligrams per meter squared weekly. What do we need to know? We've got a 5-year-old child, and from the tables, if we go back to the tables, you can have a look. A child who weighs 18 kilograms, then the body surface area is 0.74 meters squared. As I said before, don't worry at the moment how they come to that, how they work that out. You will find that out later in the course, but in terms of calculations, you'll be told this information. Here we go again. We've got some proportional sets to set up. So our weekly dose that we want to give our particular child is, we're going to call Y. And what we know is that we need to have a dose of 15 milligrams for every meter squared of the drug, of the body. So we know that our child that we have is 0.74 meters squared, and what we don't know at the moment is how much that translates to. And again, working out that equation, we come to a figure of 11.1. So basically the child should be given a methotrexate, and remember what we talked in the last one about different ways of dosing, the dosage regimens. This is a weekly dose, so it's a weekly dose of 11.1 milligrams of methotrexate. I hope that's helped a little bit in sorting out how you would go about dealing with different doses for children. What's important is that you look at the question and see what information you have been given and what information you can work out from that. Inspirational character. Some of you may have seen pictures of this. So this is Hippocrates, who is often called the father of medicine. So he is even older than I am.